Hello, friends, and welcome to another episode of the Concussion Nerds Podcast. And today we are welcoming a special guest, Dr. Zach Spiritos. Thank you so much for being here.
Oh, yeah. Thanks for having me. I'm super excited.
So for those that don't know, if you haven't seen the virtual summit lineup, Dr. Zach, is it okay if I call you Dr. Zach?
Oh, of course. Yeah.
Dr. Zach is coming to speak with us, and I am so excited. So I've told you guys before, if you listen to me for a while, you know, if you have something you want to ask someone, just ask it, because all they can do is say no. And I stumbled across Dr. Zach on Instagram. If you don't follow him, it will be dropped in the notes. Please do. He is a neurogastroenterologist, and I am always like, I butcher that term. And Zach, I'm going to get you to explain to the audience in a moment what that actually is and what you do in normal language. But I absolutely loved his content. And I loved his content because it was both humorous, but real. And this is going to sound so terrible. He's an MD who is looking at the whole person. And in this space, sometimes that's not the norm. And so I reached out to him and I said, you don't know who I am, but here's what I'm doing and I'd love you to be part of it. And he said yes. So I'm so honored and excited for you to be part of the summit. I'm thrilled that you're here today. And I wanted to everyone listening, I wanted you to meet him as well so that you can get excited to hear his bigger talk, which is going to be talking about POTS and Mast Cell Activation Syndrome for the summit at September 27th and 28th. So Zach, welcome to the Concussion Nerds Podcast.
So excited to be here. That was such an amazing introduction. I don't deserve it, but it's wonderful. I appreciate it. So yeah.
I would love for you to just kind of introduce yourself a bit more, who you are, what you do in terms that are not neurogastroenterologist.
Yeah, no, that sometimes I can't keep up with what the neuro GI doctor does. It's definitely, I think we made it up to distinguish ourselves a little bit, and it's definitely an obnoxiously long name. I trained at Duke and I trained to be a neuro GI, and effectively we deal with the GI tract is effectively a big long tube, right? And there's a couple adjacent organs like the gallbladder and the liver and the pancreas. And so the traditional gastroenterologist works with the tube and some of the adjacent organs, right? They take care of the liver, they look in the tube, they're looking for ulcers, inflammation, other kind of infiltrative conditions that can cause a whole host of symptoms. And that's what happens when you get an endoscopy. They're looking within the tube.
Okay.
The neurogastroenterologist works within the tube, but also assesses how the tube moves. So we work with motility conditions that can be studied on endoscopy to see how well the esophagus handles food or how well the stomach empties. And similarly with the small intestines, the colon and the rectum and the pelvic floor. We also think about how well or how the brain communicates with the GI tract, which plays a big role in the motility because the GI tract can actually move on its own. There's something called the enteric nervous system. So the GI system can actually behave independently of the brain, but it heavily relies on the brain for external signals for what's going on in your brain, in the outside world. So, because the GI system needs cues from, how you're feeling emotionally. Is there food in the environment? Did you just eat something you didn't like? Did Uncle Bob undercook his chicken? And we need to get that out of our system immediately. So we think about how the GI system moves and also how we feel it, how we perceive it, because of a lot of the pain that we feel in the GI tract is derived from the brain-gut interaction. So the signals that the gut sends to the brain, how the brain interprets those signals, and then how the brain relays signals back to the gut to tell it to move or not move. And that's kind of the world that we live in. So there is a brilliant neurogastroenterologist. His name is Dr. Justin Brandler. He's in the Pacific Northwest, and he deemed it as the traditional GI doctor is the plumber and we're the electricians looking at the wiring.
Okay. Thank you for that. Like now I know much more about and understanding what you do. So I was drawn initially, I think your page came up across my Instagram because you talk a lot about POTS. So how did you end up taking, and I know it's not the only thing you do, obviously, but like, how did you end up having POTS be such a part of what you spoke about and what you educate on and what you support?
It's a really good question. So I saw a lot of IBS in my old clinic, which was a lot of patients who had loads of symptoms, but all the diagnostic tests were normal. And there was always 40 to 50 patients that I had just no idea what to do with. They weren't responding to traditional therapies. They had all sorts of symptoms that didn't make any sense. And then I learned about something called Mast Cell Activation Syndrome,
Okay.
which I found that a lot of these patients had. And the world started to make a lot more sense. And then as I took in a lot more patients with MCAS and advertised myself as such, a lot of people with POTS came my way because a lot of people with POTS have MCAS. In fact, I would say that there's not a single person with POTS that doesn't have some flavor of MCAS.
Okay.
And the local physicians that were POTS specialists were not seeing people for years. And so I have a pretty strong cardiology background. I went to internal medicine residency where I felt like I was pretty good at cardiology. So I started to reach out towards my old mentors and some really leaders in the field to teach me. And so I started treating POTS a couple of years ago because I didn't really have another answer for these people. And so these folks, we'd work on getting them to poop, but they couldn't stand up without feeling viciously uncomfortable. So I was like, how can I do my job well without addressing this part of things? So then I started to treat POTS. And then once you do that, you invite a lot of people with hypermobility. So people who are pretty bendy. And so my clinic became a smorgasbord of complex GI conditions, dysautonomia, including POTS, cell activation, and folks who have hypermobility.
I just want to say to the people, I know just hearing this, so many of those clients, well, you will have seen this every day in your practice, that client that you're describing has seen a dozen, some of them, medical providers. Dozen. Like I had one client, by the time she came to see me, she'd seen 42 different providers. And so many of those individuals get told it's all in their head. They're totally normal. And they feel like after you've seen that many people, they start to feel a little lost and you start to lose hope, which is one of like, just no one wants to be in that place. And so I know just hearing this for them, to know that there is somebody out there that this is what they do and you get change and you help these individuals. I always say it's on people on a healing journey is a piece of optimism for them. Like even just hearing this episode. So this makes me very excited.
No, it feels like it's definitely selfish because I love taking care of these folks and working with them. It's always complex and challenging. And so it becomes more of a partnership than anything else, as opposed to being like, do this. There's so many ways to do things. We're always learning about POTS and MCAS. The story is not yet written about kind of what we can do with this, right? There's no FDA approved medications for these things. So we're picking and choosing different things. We're using diet and sleep and exercise and new novel therapies and immunotherapies, and goodness, GLPs have entered the space now. So this field is changing. And so it's cool because it's creative, it's fun. The people are awesome and they're resilient and, they're angry a lot, right? Because they've been gaslit for years. And so, but they have a fire and you get to work with them and it's a great partnership. And, I have a great time doing it.
I love what you just started to speak about. Like we do sleep, we do nutrition, we do all these pieces because, and you can clearly hear it in the way you speak, we need to address the whole person. And I think where sometimes our medical system struggles today still is people look at things in silos. And when you have someone like POTS, or in my world, the post-concussion, POTS comes into post-concussion all the time. And this element of things, we have to look at that whole person. So if someone comes to your clinic, which I do want to talk about your clinic in a moment, what does, and you've kind of highlighted it, what does working with you, because it sounds like you take a very integrative approach, what does that journey look like for somebody? Like what can they expect?
A friend, a partner. I was at UNC before and I left because I'd have 30 minutes with patients. And then the next time they could see me was 6 months down the road because I was in the hospital, I was doing endoscopy. And these conditions, there's not a set it and forget it plan. It's always changing. Everybody's POTS or MCAS plan is unique to them. And we have some data points to kind of understand who you are and what works, but there's no algorithm. There's no equation that I can punch your zodiac sign, your name, your height, and say, this is exactly what we need to do. A lot of this is trial and error. And I tell all my patients this, we're going to hit home runs or there's going to be some strikeouts. And I'm sorry when we strike out. But unfortunately, it's kind of the nature of the beast here because when we do something, it's far from a certainty. I have this elaborate algorithm that I have, but goodness, I am humbled every day by MCAS and POTS because I learn from the patients. Things surprise me about what works and what doesn't work. So in that same vein, we work closely together. So there's frequent touch points to see what works, what doesn't work. We'll start something else like, we need like 10 days on this to see if this is working. Or, we need to give this about 4 to 5 months to see if this is effective for you. And if you need develop side effects earlier than that, we bail and we try something else. And so it's constant communication, knowing that I'm on their side, that I'm going to fight for them, and that I hear them and I understand them. And so I think that it's really a partnership.
I think that's such an important piece. Right. And it's someone that they don't have to educate. They know that you're doing the work and you're present and you're kind of guiding them along that piece, and taking their feedback matters. Their feedback is integral to the success of the plan as well.
Oh, yeah. People a menu of things that we could do, because I'm like,
I love it.
Maybe this doesn't, first of all, a patient will come in one time and is like, I want to do this. I was like, I don't think this is going to work for you for XYZ reason. They're like, I want to do it. And it works. And you're like, okay, well, I'm totally wrong here. And so you just have to be okay with being humbled by this. And if that's the attitude you take, like, you and the patient are on the same plane. Like, we're fighting the same fight. Like, we're shoulder to shoulder. There's no hierarchy here. So it's open dialogue. It's kind of hey, I know that this didn't work. Like, let's take it in this direction. What fits for you financially, logistically, based on what you've read? Because these patients also read a ton, and it's awesome because they bring new research and they're sending me papers. So it's a team effort, but the team is not myself, my dietitian, my nurses, but it's, yes, all of us, but also the patient is on the same team and we are rowing in the same direction.
I love it. I want to talk about POTS specifically for a second, but time out to Ever Better Medicine is your clinic.
Yeah.
It's virtual, yes?
Virtual.
Purely virtual.
Purely virtual. Meant to be accessible for everybody. So
can you serve anybody in the United States?
No, so I only have my license in North Carolina or Illinois. So you don't have to be a resident of one of the 2 states, but you have to be physically within those 2 states at the time of the visit. Everybody has seen me, has previously gone to Mayo or Hopkins, right? And we want to make this kind of complex chronic care accessible. You don't have to travel to Rochester, Minnesota to get this care, right? Or to Jacksonville and to the other Mayo clinics. Like, we want this to be accessible. And I know I'm not everywhere just yet, but we want to expand over time. But you can get this kind of care from the comfort of your home.
That's amazing.
And also, a lot of people with POTS and MCAS have a really tough time traveling as well. And so it's not as easy as buying a plane ticket and staying overnight elsewhere. It's, getting on a flight, people can crash and feel horrific afterwards. And so taking all that into consideration as well.
I love it. I'm going to backpedal for a minute just because there's a lot of talk of POTS and dysautonomia out there. And if you go to social media, or at least on my algorithm, it shows up on every second post. And some of those posts are accurate and some of them are not. And so I would love for you to share with our audience, what is POTS versus, I'm going to layer it, versus dysautonomia, because people are using the terms interchangeably. So can you give us some clarification on those two things?
Yeah, so dysautonomia is the umbrella term for when the autonomic nervous system is not acting appropriately. So the autonomic nervous system is the nervous system that works behind the scenes, and it reacts to the environment or receives information from the environment and responds appropriately. It determines how much my eyes tear, how much saliva I produce, how my heart rate is, how my GI system flows, to the secretions of my pancreas, to kind of sexual function and bladder function. Like, it's everything that we don't think about, right? And that's the autonomic nervous system. So dysautonomia is a huge term for a lot of different conditions where that isn't working properly. POTS is one of those conditions that is, by definition, a form of dysautonomia. But there are other conditions or forms of dysautonomia that aren't POTS, if that makes sense.
Complete sense.
So POTS is an acronym that stands for Postural Orthostatic Tachycardia Syndrome, which effectively means it's postural. So when you go from a laying to a standing position, your heart rate kind of goes through the roof. And there are certain tests that we can use to kind of determine whether you have POTS or not. And there's a couple tests that we can use, but it's far more complex than that. So, when we stand up or we go from a laying to a standing position, we dump about 1.5 liters of blood in our lower extremities and our legs because of gravity. And so when that happens, our body in a very coordinated manner is supposed to shoot that blood up to our heart and our brain so that our heart gets enough blood so it can deliver blood and oxygen to all of our vital organs. But in POTS, it doesn't work so well. So blood either continues to hang out in our lower extremities or belly because our autonomic system can't make the appropriate changes to get blood to the right place at the right time. So when inadequate blood gets to your heart, your heart starts to get a bit anxious and say, oh my goodness, I need to get blood everywhere immediately. And so it starts to pump like this. Okay. And then your brain gets less blood. So you develop brain fog, fatigue, migraines, headaches. But also on top of that, POTS folks have less blood volume than they should otherwise have. And that's a different dialogue altogether. So they have less blood volume. Blood is going to the wrong place at the wrong time. But it's far more complex than that because these folks often have mast cell activation syndrome as well. So kind of it's a package deal that if someone has POTS, they're going to have some flavor of mast cell as well, which leads to a whole host of other symptoms. So albeit we have condensed this really complex pathophysiology into really an acronym that says you stand up and your heart races, but it's really complex.
Thank you for saying that it's not just that there is these complexities to it. I love that this is a snippet, you guys, of what you're going to get for his talk, because he's talking about POTS and mast cell activation syndrome in the summit. But can you explain briefly what mast cell activation syndrome is?
So mast cell activation syndrome is the inappropriate activation of the cells called mast cells in our body. Mast cells are inherently very good for us. They are the front line of defense in our immune system. Their job is to survey the environment as well. And they detect viruses, the presence of bacteria, parasites, hormone changes, stress, temperature, pressure changes, emotions, and they respond appropriately. But in mast cell activation, they're kind of perpetually turned on. And then certain triggers, they're like the threshold to degranulate all of these little chemicals inside of them, which they're over 1,000. They have a lower threshold to degranulate. And when these chemical mediators degranulate, they can cause a whole host of symptoms. And it's a complex interplay between mast cell and POTS. So I've had patients where I treat their mast cell and the POTS goes away. But, I certainly also think that dysautonomia itself can make mast cell worse because mast cells live everywhere. They live in all of our kind of every body part that interfaces with the environment because it needs to test and see and check out what's going on around it. So the skin, the GI tract, the lungs, the genitourinary tract, but also lives in the brain. And that's very relevant to our concussions, the meninges, the dura, the vasculature. And so in dysautonomia, when blood isn't going to the right place at the right time, mast cells also live in the perivascular spaces. And so when blood is either congested or there's not enough blood, I imagine that also aggravates mast cells. So when you're treating mast cell, you can make POTS better, but also making POTS better inherently will make mast cells less aberrant and more under control.
Awesome. I'm sure some people that are listening to this know they have mast cell activation syndrome. And so to that person, so again, social media, the joys that it is, literally yesterday when I was like, I get to do my podcast interview with Zach tomorrow, there was a post that showed up, someone sharing this new medication or this new tool about how it helps mast cell activation. And I was like, universe. I was like, I'm just going to save that post and ask Zach about it on our podcast. Ready? So this individual shared it because it helped her a lot. And it's something called KPV.
Really? It sounds like a peptide to me.
Love it. Yes. It is a tiny tripeptide of lysine, proline, and valine that naturally occurs in the body and is thought that it calms inflammation at the cellular level, reduces histamine release and mast cell activation, supports gut repair, and modulates the immune system. And so it's called KPV. Have you ever heard of this one?
I have. I don't use peptides very often.
Okay.
So peptides are the new kid on the block. I don't know a lot about them.
Got it.
I am a cautious individual. And in mast cell, these people are inherently very sensitive to the world. They don't need much drug. They get all the side effects of medications. And so I use medications that I know how they work and I know the long-term side effects of them. There is insufficient data on peptides to know what they do and what they don't do. I heard them be wildly successful for people. And I'm okay with pulling that out when I'm comfortable doing so. So that means that when we've done the lifestyle piece, we've used medications that I know really work, have data behind them. I know the safety profile. They're not peptides are also pretty expensive as well.
Okay.
And so you're also committing. So when we make a plan for mast cell, we're making a plan for the next couple decades, right?
Okay.
And if we're choosing something at $200 a month. I don't know how much this costs, but they're not cheap, right? And maybe they're $50. But are you committed to paying that much money forever, right? And unfortunately, we have to talk about the cost when making these treatments. Right. So I have a list of about 15 peptides that I have anecdotally, I know work for certain things, whether it's POTS or mast cell or something called myalgic encephalomyelitis chronic fatigue syndrome, long COVID.
Yeah.
Sure. We can have a dialogue about that. If you want to use it, I support you. If you want my guidance, it's not the first thing I would choose. But I also always meet a patient where they are. So when I've had patients today who are just starting their POTS and MCAS journey, that they saw me on Instagram or they got a referral and they were diagnosed 6 months ago. And then I have other people who have been on this merry-go-round for a decade and they've tried everything, right? And that's when you start to pull out kind of some of those options while also revisiting, like, have we missed anything? Is there a occult infection in there that we have yet to discover? Is there some mold back there that we don't know about? And there's a lot of emerging immunotherapies and things like that that I am more comfortable with because I know that they work. Take, for example, sirolimus. It's a medication that we use for kidney transplants, right?
Okay.
And it actually has some data in long COVID and myalgic encephalomyelitis. Not everybody needs it. I rarely, if ever, pull it out. But I know it works and I know the side effect profile because I know hundreds of thousands of patients are on it for another indication. Peptides are different. I just don't know enough about peptides. So I'm thrilled that she did well. I'm so glad. Am I open to it? Of course. Am I simultaneously nervous and does it make me anxious? Of course. But my mind is always open. I'm always willing to listen and learn more. But there's just not a lot out there in peptides these days.
Thank you for sharing that. And I appreciate that kind of approach as well. I had a question. So I obviously work a ton with persistent concussion and functional neurological disorder, POTS. The people that have seen people and are stuck is who comes into my door. And so what would you say to someone like myself, who's a clinician who sees these clients, that would flag us, that we could ask in our own histories that might help us know about mast cell activation syndrome, for example, to flag that for ourselves so that we can guide our clients? And then the next question would be, who do we guide them to, would be the next question. But to help us so that we have that knowledge to support our clients more.
Yeah, I think it's when they have a lot of symptoms and a lot of different organ groups that don't quite make sense. Or a patient has seen a lot of different subspecialists for symptoms in every organ system, headaches, allergies, GI for IBS, cardiology for tachycardia, and everybody is saying they have something or have a symptom and they're treating that symptom with a medication, but there's no kind of unifying common denominator there. So that's what I would say is that, because typically people are going to see the first line of defense is seeing these subspecialists, but when they leave and they're like, well, they just told me my heart rate is fast and they put me on a beta blocker, I have allergies or I feel like I have allergies, but all the testing is normal. So it's basically a lot of symptoms, a lot of different organ groups that quite frankly don't have a unifying diagnosis.
I think something else you said too, is this always in mast cell, or not always, but common, the comment you made about someone who is sensitive to every type of medication they're ever prescribed, because I hear that a lot in my practice.
That's mast cell until proven otherwise.
Yeah. Okay. Yeah, so that is something I hear all the time.
It's incredibly valid. So they get all the side effects.
Yeah.
And it's mainly not to the drug itself, but it's to the excipients or the additives in there. So if you take a medication and you look at it, there's something called an NDC code. And if you go to dailymed.com and look up the NDC code, you'll realize that in your medication, there's also 9 other things in your medication, including what the capsule that it's in, right? And so there's something called microcrystalline cellulose that is in a lot of these pills that is made from pine trees. So if you're allergic to pine and you have MCAS, you're going to get a reaction to this, right? And so I remember in medical training, people were like, oh, that person's allergic to 30 medications. They're nuts, right? But we didn't know any different. Like we just didn't, that was obviously a horrible thing to say and dismissive, but that's kind of what I was taught. Like, oh, that person must have something psychiatric going on. And then you learn more that no, they just have these very reactive mast cells, and there's all these things in the medication that make the body go haywire and generate all this inflammation. So yeah, it's a very real thing. And the medications that you can use for people with mast cell are much, much lower than what you would use for someone who does not have aberrant mast cell activity in their body.
That is okay. I'm going to tuck that one away in the back of my tool. And I'm going to just add this, I think, to like my repertoire of questions when I start talking to people. So say someone now is presenting in front of me and they're describing all these different things and they have the IBS, they're having like the fatigue issues, we're having inflammation, we're responding. I can't take medications because I react to everything. So I'm like this little yellow flag going off like, okay, well, this person might have mast cell, not something that I treat. Who do I send them to?
I don't know.
And I know that's a loaded question.
I don't
know. Where would I even start to look to send them?
I would say go to local Facebook groups. I think those are the most reliable sources of information. If you go to like Mast Cell Atlanta or Mast Cell wherever you live, there are going to be people who say this provider knows what's going on because they can be in various different subspecialties. So, I think my knee jerk would say allergy, but I know a lot of allergists were trained on mast cell because it's just kind of becoming popular now. It's fraught with controversy in terms of how you diagnose this thing. And, I'm a GI doctor. I treat it. I know cardiologists that treat it. I know PM&R people that treat it. I know internal medicine doctors that treat it. So I think you just have to find, because we all did it out of curiosity. Like I didn't subspecialize in this. You do it out of necessity because you're like, I have all these patients. I don't know what to do with them. I don't know where to send them. So there's no one studied this per se or had formal training. It's all kind of guerrilla warfare. We're out there reading on our own and, sharing stories with each other to better understand this condition. So I think it's word of mouth and talking to other people who have the condition. Yeah.
Okay. All right. Facebook groups, here I come. I want to thank you so much for being here today. I know you have a crazy day as well. So it has been an honor to actually get to meet you and have this conversation. And I know you just have such a wealth of knowledge to share with the community and honestly, globally, because that's where our lovely social media gives us reach. And I'm excited for the continued growth because when did Ever Better start?
3 weeks ago.
I was like, it's new.
Yeah, well, we're, I think, almost at capacity in terms of new patients that we can take on. So we've exploded fast. It's been great. We're going to grow. We're hiring new people to accommodate all the people that need to be seen. Because I think it just, we filled up very quickly and we're not at capacity, but we're quite close. We're going to continue to grow to new states, hire new people, because I think it speaks to how many people are silently suffering with this.
Absolutely. Well, congratulations on that. And to the clients who get to work with you on that journey. I mean, it's like you just said, to be full 3 weeks after opening those doors, virtual doors, the need is there. It is so there. And you and your team are giving hope and healing to people who, for some of them, thought it wasn't attainable anymore. So
that means a lot. And I appreciate what you're doing as well. And obviously the concussion space is challenging for the same reasons that kind of the mast cell space is challenging. So I appreciate what you do as well and spreading good information out there.
Thank you. If you had to leave one word of advice or inspirational message or motivation to individuals listening to this, what would you say?
If you haven't found your support system yet, keep looking. They're out there. There are people that want to listen and fight for you and be curious and have your back. I've met them. I talk to them all the time and they're out there. Just continue to look and, just keep your eyes open, ears open, listen to the social media or go on the social media pages, find your team out there and hopefully you can make some strides with the right people at your back.
Thank you so much. For those listening, I will drop Dr. Zach's handle below. We'll share the website, all those lovely things. Come listen to him at this summit as well. If you haven't already signed up, the link is below there too. And until next week, my friends, have a lovely day. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.